Hello and welcome back to the Code Treat. I am Jonathan, your occupational therapy professional today.
And I'm Magnolia, your speech therapy professional today.
Yay!
Woo!
And this time Magnolia said she was not going to start it, so I started us again.
I'm just going to make it special.
Everything feels right on the Code Treat.
It was the day of the Code Treat.
Yeah, okay. This is our third one that we're filming today. Just giving you guys an insider scoop. This one and the past two, we're filming them all in one day, which I think was the most we've ever done in a day, right? 3?
Yeah, I think so.
I think normally the most
two, maybe.
Yeah. Oh, definitely. We've done 2.
Mm-hmm.
But yeah, fun times.
Mm-hmm.
So we were kind of talking, like, what do we want to talk about now?
Mm-hmm.
We've talked about a lot of different things at this point, but I don't think we've ever done a really good kind of like breakdown of kind of a guide to, if you're a parent or someone who's not super familiar with therapy, like what does it look like? How does the process go? Like what do you expect? What do you expect when you're just as a nice little intro to therapy?
What to expect when expecting therapy? When
you're expecting therapy. Yay. So
we know a lot about this process because we've worked in clinics. So we're specifically talking mostly about pediatric.
Oh, fully. Yeah.
Evaluation.
Oh, yeah.
Let's make sure we
fully just talking
that.
Yeah, because it can be completely different.
Yeah.
I mean, well, it is. It's completely different if you're starting therapy in a hospital, if you're starting therapy in a nursing home. That's a completely different thing. We're specifically talking about pediatric therapy.
Yes. And so
pediatric outpatient
therapists for a while, which y'all know. And then I've also am kind of in an admin position, so I kind of get to see some of the back end of things as well. Yeah. So that might be kind of helpful for some of this information as well.
Yes. So the first step.
Yeah.
What do you think? What would you say is the first step of this kind of process, Miss Magnolia?
Well, I mean, definitely first off would be just noticing like any signs and stuff. So definitely go back to some of our like developmental, like what is OT, what is speech episodes, I think would be kind of good. And maybe some of our developmental episodes and listen to those. But if you feel like anything is off or you have any questions whatsoever about your child's development or their behaviors or things that are bothering them, I think definitely talk to your pediatrician. There's different options for that. Either call and make a separate appointment or bring it up during like a well visit check when you're there.
Yeah. And so like if you're recognizing signs, then, or you feel like your child is struggling with something.
Yeah.
Feel free to like bring it up and talk to the doctor about it. And
no matter the child's age,
for sure.
I mean, because challenges come and go. And so it could be a challenge that's like reading and writing and stuff as their older child, or just like worried that your child might not be saying enough words at a certain age. Those are all valid concerns to bring to your pediatrician.
Yeah. And so that's often one way that people the idea of therapy presents itself.
Right.
Is, they have identified some concerns and they bring them up to the doctor, and the doctor's like, okay, well, maybe your child needs a little extra help. So there are these therapy services, speech, OT, PT, whatever, for whatever need that your kid has. So like, let's explore that.
Yeah.
But also that's kind of one of the main 2 ways that people get, kind of get the idea of therapy in their brains is they have the concern. But then also what happens often is maybe the parents don't have a whole ton of concerns, but at those child visits, your doctor may mention like, oh, hey, we've done, because they do developmental checklists, at your doctor's office. Maybe your child's not sitting up at this point, or maybe they're not walking yet. Maybe they don't have this many words. Maybe they're, having a hard time with potty training and they're, 5 or, whatever it could be. There could be any number of things that your doctor flags as like, okay, this is a concern because it is, a delay from what is kind of the standards, the kind of the published standard norms, which just means like these days, what that means is, like the CDC just recently in the past couple of years redid their developmental milestones. And so now on the checklist that your doctors have, if your child is not meeting the milestone, then that means currently that 75% of kids their age are completing that task at the age that they are marking on those lists. Which just means that like your kid might need some help to catch up or to come to a level of, to get back to meet that same level of independence that was kind of expected for their age. But then also it could be that, it could be some other medical things going on. Maybe your kiddo has a medical diagnosis and it's time to introduce some level of therapy to help support them, whatever it could be.
And the CDC has a good website too about those developmental milestones that you can look for your child's age and kind of do your own little screening too and kind of see if you need to make some concerns made known to your doctor as well.
And I know that can be pretty like jarring for parents when they weren't expecting to go into the pediatrician's office. They were like, everything's fine, like, everything's going great. And then the pediatrician is the first one to be like, hey, actually, I do have some concerns about this area or that thing or whatever. And this is what I would like to say to parents. For one, don't be too hard on yourself because oftentimes, like, especially for first time parents, we see this a lot where like a lot of first time parents feel a lot of guilt and a lot of like, they feel like, oh my gosh, my child's behind and it's my fault because I didn't know what the signs were and I didn't do enough or whatever. And I'm like, give yourself a break, cut yourself some slack because you're doing the best you can. And I always tell parents by the time they come to me, I'm like, clearly you care about your kid and obviously you want what's best for them. Otherwise you wouldn't be here.
Right.
And like you're taking steps to like try to help your kid. So like cut yourself some slack, you know, and I know that it can be, jarring when you're not expecting it.
Right.
But truly like any number of things can happen and any number of like all kinds of people. We have people from all kind of like backgrounds and ethnicities and socioeconomic status and like everybody needs some help every now and then. So please do not like, and we're here to help. Right. So like if you do have fears and you do have some anxiety and nervousness about it, we're here to help. And please express that. We are here to put your mind at rest and do as much as we can to like help support you. So that said, like initially, oftentimes the first point in which someone suspects or is thinking about therapy, it's either because they've identified concerns,
right,
or the pediatrician has. And either way, it starts with a pediatrician.
It does typically, yes. I will say, I did want to add one more thing. You mentioned like how the CDC, developed those guidelines for us. I do want to add one more resource really quick. There's actually an app called CDC's Milestone Tracker. So CDC, then apostrophe S, Milestone Tracker. And it's really good as well. You can actually like put your kid's name in there and their age, and it kind of tracks what milestone should be happening at that time.
That's cool.
So it's really neat. And it's, like you said, it's not to make anyone feel bad if your child is starting to kind of fall behind on certain milestones. But I would think that everybody in the therapy community, we're really moving away from the wait and see model. We really want to go ahead and kind of intervene early so that we can also meet those skills early and graduate early. Because we don't want we don't want people to need us for long. We want to be able to intervene early and help families out very quickly.
Early intervention is key.
Yes. So first step is definitely talking to the doctor, bringing your concerns to the doctor, or the doctor may bring the concerns to you. So that's something to be aware about. Another option I did want to mention is that a lot of clinics, will offer free screenings. So that's really important too, is if you have questions, you may could look up the clinics in your area that offer speech, occupational therapy, physical therapy, and see if they'd be willing to do a free screening and answer some questions for you. That's an option. Also be aware that a lot of daycares and schools do screenings frequently as well.
That's true.
So they may have professionals come into your child's daycare or preschool or school and do screenings if you sign a permission form to allow that. So that might be another way that you get some information.
And teachers also may themselves do some like I mean, they're also interested in developmental progression of kids and all that stuff. And so oftentimes it's teachers who are like, hey, your kid is like having a hard time in this area, whatever that means. So like, you know, that may also be an area that happens. But then also some community centers. They're it's not so much in our area, but I know in some other areas around the country where of community centers who have, like for us, we had an opportunity. I was not able to do it, but, my school, which is in Nashville, Tennessee, big city in the States. But there was an opportunity for us OT students to be a part of a community health drive type thing where we could do like developmental screenings for kiddos if people wanted to. And they were free. Like you could just come and, you know, get a free, it gives the students experience doing those kinds of things, but then also can provide some really good information for parents. Yeah. So there are many different ways, but to hear about therapy, but ultimately it comes back to the pediatrician then fulfilling the next step, which is referral.
Right.
So tell us about
pretty much I mean, I'm not sure of the rules of every single state, so I won't claim to know that. But in Alabama, to start therapy, you would need a referral from your pediatrician or like your primary care provider. And that referral is pretty much just a slip of paper that, you know, lists the demographics of the patient, which is like name and it gives us like patient history and stuff. It tells us the patient's insurance and is signed by the doctor saying that he's referring to therapy, or he or she is referring to therapy at the discretion of the therapist.
Yeah.
For like this certain period of time.
Yeah.
And so that should be sent specifically to the clinic. The clinic, you and your doctor should already decide what clinic it is going to prior to the referral being sent out, unless if they're giving you a physical referral to take to a clinic.
Yeah.
But if they're faxing the referral for you, it would be kind of like sending a prescription somewhere.
Yeah. It's a very similar process as to like if you for yourself have ever gone to see a cardiologist or gone to see, you know, some other kind of specialist, a specialist doctor, like it's the same kind of idea. Like you just need some information from your doctor saying, hey, you're coming here. These are my concerns. This is why I'm referring them to you. Yeah. And then you kind of take it over from there.
Yeah.
To treat as you see fit because basically what it's saying is like, you need help that's outside of my scope.
Yeah.
You know.
But yeah, a lot of times your pediatrician or your primary care provider might tell you, you know, what clinic they suggest you go into, but you also have choices in what type of clinic you want to go to. So that's also really important. If you would like to do research prior to going to that doctor's appointment, you can ask specifically for what clinic you want to go to. It would be the same in that example as if you went in saying, I would like to go to this cardiologist because you've already researched.
This is who my husband goes to. Right. This is who my mom goes to.
I know they take my insurance already. Like all of those important things. Yeah. So let's talk about like what you could ask clinics if you were researching, like what should you be looking for? What could you call and ask them before you like tell the doctor that's the one you want to go to?
For sure. And something to keep in mind is your options are unfortunately going to be limited based on your geographic location. Like in our area, there's not a ton of options. Just because we are a more rural area. And so like in the county that we live in, I only know of two pediatric clinics in the whole county. And then in the county that one of our clinics is in, it's the only clinic that I know of in the whole county.
Right.
And so like it is possible that you may not have a whole ton of options just fully because of where you live. But like at the clinic that I work at, there's 2 in our town. And then I think there may be some other ones there are some other options nearby. So keep that in mind. I don't want anybody, I mean, that is a little bit bleak, but it is just kind of the nature of healthcare, unfortunately.
Right. Well, there's also a little bit more time commitment that's going to happen for your therapy session. So versus like going to a specialist like a cardiologist, you may not have to go every single week.
Yeah.
So it's important to think about that you're going to need to look for somewhere that you are able to or willing to go to multiple times during a week. Potentially. But that doesn't mean you can't call and ask questions.
For sure. Absolutely.
And decide if it's a good fit for you. Yeah, because you are going to be making a big time sacrifice of your day to drive over there or to change your schedule around to where you can get to therapy. Yeah. So it is important to ask questions if you have any type of concerns.
And if you are in a space in an area that does have more physical locations, then it's very important that you it's always important, but some people just based on where you live will have more physical options. Yeah. And so it's good to know what some of these things. So what are some of the questions that you might ask?
Well, I would definitely start, personally being a research driven person, I would definitely look up their website first and kind of go ahead and get a look at, do they have any certain specialties that they might list on their website? Yeah. What kind of services do they offer? Because not every clinic offers all 3 services. It may be a speech only clinic. It may be an OT only clinic. Yeah, so that's important to look at as well. Things like that, just kind of, get a glimpse of the overall vibe of the clinic by looking at the website. But I definitely think it's a good idea to call on top of that to kind of ask questions. The first few questions that come to mind are asking about specialties for sure, especially if you have specific concerns for your child. So if your child is struggling with something like dyslexia or things like that, you're going to want to ask if there's anyone with specialties there. With reading specialists, things like that, or speech therapists who have strengths and training in dyslexia, things like that. If you're having a child who needs help with emotional regulation, I would definitely ask as well, do you have any therapists who are trained in any emotional regulation strategies or things like that? I think that's very important. Yeah. What do you think about any specialized trainings?
I agree. If your kiddos have, some things that come to my brain are feeding. If your kiddo is a really picky eater, especially if there's concerns swallowing concerns that you're afraid that they're not a safe eater. Yeah. Then you don't want them going to anybody that you don't want them to go into just any entry level OT or speech therapist. You want someone that has some advanced training on swallowing disorders and how to make sure that you are getting the kind of services to help your kid be safe. Right. Because it is harder. I know as OT, feeding is definitely something that we learn about in our programs, but unless you had the opportunity to work inside of, a facility that had a lot of feeding experience and a lot of feeding patients, then it's something that you definitely you need a lot more continuing education on as, when you're an independent clinician. So things like that, if you have major feeding challenges, or if it's someone who has some pretty significant developmental disorders, or maybe it's someone who has, if your kiddo is diagnosed with muscular dystrophy, do people have experience working with those kinds of conditions?
Yeah, I was thinking medical complex. If your child has a G-tube or anything like that, make sure to ask, are there therapists there who are comfortable and who have worked with patients with G-tubes before, so they understand how to operate in those settings.
For sure.
Because you want the most appropriate care for your child.
Yeah. And I think one thing that I want people to be aware of, maybe this might be a little controversial, but I think it's important to ask very specific questions about like, this is specifically what we're interested in, and not just like, does OT or speech work on this?
Yeah.
Because some people might say, well, yeah, we are OT and we're speech or we're PT. And yes, this is within our scope of practice, but that doesn't necessarily mean that they have the specialty training to give your kiddo the best possible care. And that's not a slight to them. That's just, you only know what you know.
Right.
And like, for instance, like if someone, just as an example, if someone were to come to me with some like really significant like swallowing difficulties, I may not be the best person to help them because that it's just not an area that I have a whole lot of advanced training in. So, you know, it just is what it is.
Right.
That's not, but I would be a really great person for other things. Or another just example, if somebody's having some really major like handwriting challenges, I may not be the best one to help them because I don't have any sort of like formal advanced training in a particular type of handwriting curriculum or handwriting method, that some of our other clinicians do. Yeah. And so, yeah, like if your like primary concern is this kid's got really like challenging handwriting because of whatever, maybe I'm not the best one to work with your kid. But if your kiddo has some really intense regulation needs, then I am much more suited to helping them. So I think being very specific about those questions.
And after you get those answers, I would make sure to advocate, like, yes, I would, if you do move on to scheduling, like I would like to be scheduled with an evaluating therapist who is aware of those concerns and like who has training in those areas. And then you might need to bring it up again during the evaluation to that therapist that you would like to see a specific therapist who has training in those areas.
Yeah.
And you are more than allowed to advocate for that. Yeah. So it is definitely something to think about. You may have to bring that up multiple times though. You may have to bring it up when you're calling to ask and doing research. And then you may also have to bring it up during the evaluation so that it follows through. And we can talk more details about that. Sure. So other things that you could call and ask about, you definitely want to ask about attendance policies. That's really important. A lot of different clinics have different attendance policies. Do they have no-show fees? And that just means like, do they charge you a fee if you do not come to the appointment?
And no-shows are like, you don't come and you don't call ahead.
Right. Yeah.
Like if you have to cancel, usually people don't have, I don't know of anywhere that has cancellation fees.
Not that I know of.
But it's possible if it's like, you don't cancel within an hour of the appointment or something. But usually not, if somebody is going to have a fee, it's going to be a no-show, which means that you weren't able to make your appointment. And there was no like heads up that, hey, I'm not going to be able to come.
Right.
Which honestly, let's be real, sometimes things happen.
Yeah.
And like, if you have some sort of a crisis, it's totally understandable that you like didn't call us because you had some big medical emergency or whatever. But so, I mean, it does happen.
Right.
So please don't let it like scare you too much.
Right.
Because hopefully people will be accommodating and like understanding of like, okay, life does happen.
Yeah.
And there's just.
But it is important. Make sure you understand those policies before you go to those clinics.
For sure.
Making sure that they do accept your insurance is definitely.
It's a big one.
Big one. And if you have any questions about what specifics that your insurance covers, like go ahead and ask that then. We won't go through specific insurance details right now, but certain policies only cover a certain amount of visits. And so it's really important. And you could go ahead and have them check your insurance and ask them to have somebody from their billing department call you back to let you know how many visits you could get or how much your copay would be, because it is different than a regular doctor's visit. So it is important to understand that.
And
as
like
well.
ask about private pay rates if your insurance isn't accepted, because unfortunately healthcare is a business and unfortunately everybody this is our job. So it is how we make our money. Yeah. It is how we make our living, not how we listen. I ain't getting rich on therapy.
Making extra money.
No. No.
That's how we pay bills.
But unfortunately it is like, that is something to consider. And sometimes that can be a factor that influences the type of therapy and how much therapy someone is able to receive is insurance and their income and that kind of stuff. And in Alabama, our idea of insurance is a little skewed because there are not very many major providers in Alabama. like we have Medicaid and Blue Cross Blue Shield, and that's basically the majority of what we see.
Right.
But I know in other states that's very different. It's actually a competitive insurance scene, and there's not one insurance company that has a major monopoly. Definitely was a little bit of a political statement about Alabama, but some aggravates the dog out of me. But so it is important for people to like ask those questions.
Yeah, and I would ask it before the evaluation happens.
Absolutely.
Because once that evaluation happens, you're in charge, like you are financially responsible for that evaluation.
Yeah.
And then if you start treatment sessions, then you're financially responsible for anything that happens after that. So it's just important to talk about that. Other things, I would start asking questions about the clinic if that interests you as well. So like what the layout of the clinic is the treatment one-on-one? Are the patients around other children? And this is all based on what your comfort level with is. Me as a mom, I personally am okay with my kids being around other kids, but not everyone are, and that's totally okay. Yeah. It's according to your preferences. Some people, you know, have different preferences about that. So,
well, and we've experienced some kids who like, they're very medically fragile.
Yeah.
Where like they can't be around a whole bunch of other kids because their immune system they have like immune deficiencies.
Right.
So like they're more sensitive. So those kids need to be isolated from other kids. We have to make sure to like take extra precautions to sanitize the room before and after they leave. And so like things like that are very important to like make sure that they have a space to be able to do that.
Make sure the clinic's willing to do that.
Yeah.
Other things are just making sure like, or not making sure, I don't want to say that, but if it's interest to you, asking if it is going to be one-on-one therapy in like a room separate from others, or would it be in a like communal area? That is something that you would want to ask if that's something that you think would impact your child. And then other things would be, can I go back in the treatment rooms with my child? Or is there a policy for that? As well, is there a policy for me to stay on site with my child? All of those things. Who can drop off my child? Who needs to pick them up? Like, does it have to be a parent and a guardian? Those are all important questions, I would say.
For sure. I had another one. And another thing to consider too is, especially for people who may speak a different primary language than the staff, like what kind of services do they have to like provide translation? Do they have an on-site translator? Do they use some sort of a call center? What does the access to, translation look like within that clinic? Is that something that we are fortunate enough to have translators on site with our very large Hispanic population, but not everywhere has that. And so that's something, but similarly, like if we had somebody come in that spoke a different language besides English or Spanish, we would have to take extra, steps to communicate with them.
Right. And that's a very normal call that we do receive at our clinic, actually, is like, hey, we've had a parent who is hard of hearing, so we've received a call of like trying to coordinate, making sure that we could accommodate for that. And it's important to make sure that your the clinic that you're planning on going to is prepared.
Yeah.
And that can,
for sure,
I don't think best serve you.
Yeah.
Would be the way to look at it.
Yeah.
But once you know what clinic you want to go to, you've told that to your doctor, the doctor sends the referral. What'll typically happen next is that specific clinic will call you to schedule the referral.
Schedule the evaluation.
The evaluation. Thank you. Yes. Yeah. Schedule the evaluation. Sometimes I know clinics get really busy. There's often wait lists. I don't know how it is in the rest of the world, but that's how it is. In our little area, probably because we don't have many clinics and we live in a very rural area. But I would definitely say it's completely acceptable to call and advocate if you haven't heard anything.
Please do. Like, please call.
Yes.
Like, I'm the person, please call anybody. I'm the person who's like, bug the healthcare providers.
Yeah.
Bug them. Call, and I don't care who it is. Call your doctor, call your therapist, call your dentist, like whoever. If you haven't heard from them in a while, call them.
Yeah.
Because I will just be totally honest. Things do fall through the cracks. Yeah. Things do get missed. Medical offices are very busy places. There's a lot of moving parts going on. And so if you haven't heard from somebody, call them.
Yeah.
It takes like not that much time to just call them and be like, hey, did you get that referral that was sent? Like, just wondering what the timeline is on that. And please do. It's happened more than one time that I'm aware of where like someone, well, that was very helpful. It was very useful for someone to like call. Yeah. And just give a little reminder of like, hey, this is who we are.
That's a good point. So typically when you are setting up an evaluation, you'll work on getting it scheduled. They'll typically send you intake forms, or you will fill intake forms out when you get to a clinic, just like you would at a doctor's office. Specifically, these intake forms at most clinics have questions about like developmental history. So it would be good to go ahead and be prepared to kind of write your estimates down for like when your child said their first word, when did they start sitting up, when did they start drinking a bottle. Those are the things you kind of want to go ahead and start racking your brain with, because those are going to be the type of questions on the questionnaire. And then it's going to be like, what are your main concerns? They're going to want birth history. So like how many weeks, things like that. So that's definitely important to go ahead and be thinking about. Filling out those intake paperwork is so important. It helps the evaluating therapist really get a better picture of what the parent's main concerns are, and then any like specific history that might be impactful in understanding the child better and understanding like what diagnosis there might be.
Yeah.
So yeah, anything to add to that?
I think you're good. Okay. You got
it. So then evaluation day would be scheduled. You would come in. Pretty much at every clinic, you would be expected to bring your parent ID and your child's insurance card. So that is just a key reminder right here.
Make sure to have your paperwork.
Have the paperwork. And typically arrive early, and the evaluating therapist will make sure to review the paperwork. Evaluating therapist means like an OT or an SLP or a PT, someone who is licensed and certified to be an evaluating therapist, someone who does the evaluation and can write plans of care. So they'll come out and get you from the lobby and take you back to wherever they're doing the evaluation. You can use translating services if that clinic has it. Like Jonathan said, we're very fortunate in the clinics we have to have translators, and we utilize them frequently. Evaluations typically start out with a simple like question interview with a parent. And this is kind of where things can kind of go all differently. So evaluations can look differently in every single clinic.
For sure.
A glimpse in like my own personal evaluations that I do. I always like to start with kind of reviewing the case history, making sure I have the list of medications correctly, making sure I have a good understanding of like any medical history. Being a speech person, I'm always going to ask you about, has the child have frequent ear infections, or are there any hearing concerns, any swallowing concerns, eating, feeding concerns, just to make sure that we have all medical things down. We'll often talk about your child's like daily routine, daily life. We'll talk about family history. We will talk about like the developmental history as well. Like when do they start crawling? When do they roll over? Things like that. Are they drinking a bottle? I think what else? Social history. Like if your child goes to the park often, do they play at home with cousins, and do y'all go to community events? Like what kind of social life is there? And then if your child is in school, we would definitely want to know a lot about their school activities. How are they doing in school? How do their teachers say they're doing? Things like that. So kind of just like a general parent interview is kind of how I start. And typically that parent interview is done while also starting to interact with the child slowly. If the child's old enough, I'll begin asking them questions as well. And then I'll also kind of just start playing with the child while talking to the parent. And so kind of getting a little bit of a play sample while talking to the parent. So parents, please do not think I'm ignoring you, but I'm also going to pay attention to your kid. It's definitely a balancing act as far as that goes.
I think it'd be really helpful to, like, if you have whatever your specific concerns are coming in, feel free to write them down before you come, because oftentimes, while I am not in the evaluations at this current stage, oftentimes parents will, after the evaluation, and they start treatment with me as an assistant level clinician, oftentimes they bring up other concerns and they're like, oh, well, I meant to mention this at the eval, or, oh, they mentioned this and I didn't really know how to respond. So like I wrote this down, or like I thought about it later, or whatever it is. So like if you are leading up to an evaluation, feel free to like write them down, like write down the concerns and like make sure that you have a list of things that's like, okay, I really want to make sure to mention this thing, or this is like, we're having particular trouble with feeding. We're having particular trouble with sleeping. We're having particular trouble with, potty training. We're having particular trouble with these big emotions. And this is what's going on. Like, feel free to please write those down, so that we can make sure we cover all the topics during that initial eval.
Yeah, that's a great idea, because you will be asked tons of questions.
Yeah.
And it's really important to make sure that we are addressing what you came in there for.
Yeah.
Because you will be asked a lot of things, because we need to make sure to cover all of our bases. But you want to make sure as the parent to advocate and keep the focus on what you came in there for.
Yeah. It's like, what is your primary concern?
Yeah. If you do not get asked what your primary concern is, tell them.
Yes, please.
That should be asked to you. But if it's not, make sure to go ahead and advocate for that. Yeah. Typically, once kind of the questions are kind of figured out, things like that, the therapist will start doing some sort of standardized testing. I won't go into specifics about those, but it should be based off of their age and whatever specialized need.
Yeah, whatever concern that you have. Yeah. Thought of. And what that means is like the standardized tests are going to be things like in the world of OT, it might be like a fine motor test, or it could be a sensory questionnaire, or it could be some of the ones that we use are it may be like related to your activities of daily living. So like the kiddo's ability to dress themselves and feed themselves and bathe themselves and do all that kind of stuff.
And these may look like questionnaires. So these may be more questions for the parent.
For sure.
But there are interactive components of the test as well with the child. As far as like with our language test, there's a lot of interactive components where we need them to point at pictures or describe pictures or move manipulatives for us. Same with OT as well. Articulation tests, they're going to repeat a lot of words after us. And we're going to listen to how they're saying words, different things like that. And that standardized test gives us the scores that we need, so that we can compare the scores with all the other information we've gathered between the medical history and all the information the parents have given us to kind of decide where the child is at. If there's a diagnosis, which we can only give, like speech therapists, we can only give speech diagnosis. So we can only add like an articulation disorder or like a speech sound disorder, or phonological disorder, things like that. We can add like if there's a language delay, if we see those, if we see stuttering, if we see voice disorders, a swallowing disorder, those are the type of diagnoses that we can give. And then you should have that diagnosis explained to you the day of, typically, if they have time to score it and go over it with you. So the test should be scored, reviewed with you. Your diagnosis, if you've been added one, should be explained to you for your child. And then it should also be described to you kind of the severity as well of certain diagnoses, at least in the speech world. Because we will have like receptive language delays or expressive language delays, and there's typically a severity that goes along with that. So it might be like a mild receptive language delay. So there's very specific wording for all of these things, but it's important to make sure you're understanding those scores and your therapist is explaining that to you as well, kind of explaining where your child is at and kind of what that means.
Yeah. And feel free to please like ask questions. Like I know some clinics will set special time aside after they've done the evaluation and after the therapist has had time to score the tests. Because especially for like in the OT world, some of the tests are very easy to score in the moment. Like you can do the assessment, especially like questionnaires and stuff. You can add those scores up and be like, boom, here's the answer. Here's the results. And like, this is what this means and, all that stuff. But then some of the, tests require analysis and like grading. So it could be like a handwriting test, or it could be, or even like the fine motor tests, for instance, like you get a score immediately based off of your performance.
True.
And so it doesn't take terribly long time to like add them all up and do all that stuff and get a kind of a rough idea of what their results will be. But then some of the ones that like are more, they may be related to their visual motor, how their eyes work and how their eyes and body kind of move together, that visual motor coordination or things like that. It takes more time to like score those.
Yeah. So you may get more of a detailed explanation later on.
Yes.
Once the therapist has made the decision of like, would therapy be beneficial or not?
And I think it would be very helpful for parents to know, ask what kind of tests your kid is being given. Like, what are the specific tests? Maybe you don't have to ask the specific tests because you might not.
What is it testing for?
Yeah, but like, what are you testing for? Like, why? And then if you haven't had a rundown of each of those tests, ask for it because it's important for you as the parent to know what everybody is seeing, what people are seeing. It happened yesterday where maybe it doesn't matter. It happened this week where I had a conversation with a parent who, she was like, I think my kiddo's doing pretty good, but according to like the functional things that we have seen and the scores on her like standardized assessment, she's still struggling. She's still behind. She's still behind in some of these areas. And so it's important for everybody to just be on the same page.
Right.
So if you know what kind of test that your kid is being given, and then to ask about it. And some clinics do a really good job of like setting special time aside to, maybe they'll even have a special session where, they'll schedule it in where it's like, okay, this is your evaluation session. And then maybe we call you with the results and like have a phone conversation with you to talk about this stuff after we've had time to, score everything and get the results. Or they'll have a special session that's like, session 1 or like session 0 or whatever, where they come in just to talk about the plan of care and kind of the assessment and all that stuff. And then other clinics are not very good at that. And maybe their communication with parents is not the best. So you may need to ask for that. It's like, hey, we got the evaluation. Now I need to, we need to sit down and like talk about it.
Yeah.
So,
absolutely.
But that is your right as a parent to know those things. So please don't be afraid to ask.
Yeah. I do want to talk more about like the experience in the evaluation that can be really important for parents to understand is, it can be hard as a parent to sit back and like watch your kid struggle or kind of even feel like they're failing in an evaluation. So that's really important to know going in is that unfortunately standardized testing have to be done. And they have to go on. Like we have to continue asking questions until we get enough information. And specifically like in the speech world, I don't want to talk for OT, but like there's one test that I give that I have to go until I get 6 zeros in a row.
Yeah.
And that can really get frustrating. It can get really frustrating. Because that means a 0 means that they were not able to do that skill of whatever we were doing. And that can get really frustrating. And I love parents. I love parents being in the eval because I want parents to see what their kids can do. But parents, we can't have your help. We can't have your help during it. Parents with the best of intentions have tried to like tell their kids the answers or like they know how to do that. They know how to do that. And it's difficult because like that part is standardized. So we do have to mark it 0 if they can't do it in that moment. But one thing I would like to add is if you think your child can do more than what they showed in that standardized assessment, tell the therapist because I do love to get that information as well. I've had an evaluation before where the kiddo really just was not participating very well. But after the standardized portion, the dad spoke to me as like, let me give you examples of how I know he knows those words. And I was like, thank you for that. Like I was able to take down all that information and add that to my assessment. Because those are skills that kid had. There was no reason to address those skills, even though he wasn't able to show me during that standardized assessment. So make sure to advocate and tell the therapist what all your child can do, at home, even if they weren't able to show it during that standardized test.
Yeah. And another thing to kind of along the same vein, like, it's a judgment-free zone.
Mm-hmm.
So like, please don't apologize for the things that your kid can't do.
Absolutely.
It's like, that's what we're here for.
Mm-hmm.
We're so here to be supportive and be helpful. And like, that's our whole mission. So please do not apologize if like your kid can't do this thing or can't do that thing or, whatever it is. It's like, we get it. Like we're here for you. So you got this.
Yeah.
We got this together.
I do. But after that, there should be a discussion at some point, whether it's that day or another day, according to how the clinic does it, that discusses like the steps moving forward, whether or not they made a recommendation for therapy, whether or not they gave another diagnosis on top of what the doctor may have had, and whether or not how many times a week therapy should be done, all of these things. So that should be a conversation had. And you should be discussed about like why the importance of therapy, and then their recommendations as well. And then kind of the opportunity to ask like the parent should happen of like, do you want to pursue this? Do you have any questions? Do you think your child would participate well in doing like this many times a week? Like you should be a part of the conversation for that planning process. So make sure you advocate for yourself and your family of like, yeah, we think that's feasible for us, or no, like we just can't realistically make it to the clinic 3 times a week, like something like that. And if you're really not interested in services, make that known as well too after the fact. So,
yeah, for sure.
I mean, I've had conversations with parents before following an evaluation where I've kind of just presented the information to them of like, hey, your child has like very minimal expressive language delay. See it right here. They're about this month level compared to what their age is. But we kind of reviewed the history and I kind of discussed with them of like, we could do some early intervention here to kind of help build up the vocabulary skills, but that I wasn't too concerned because she also had a history of, frequent ear infections and things like that. So maybe with some time and like maybe going to ENT, we could get all of this resolved. So we kind of talked about it. I was like, but we could do speech therapy because in that time, speech therapy could definitely help with that. We could definitely help build her language and things like that. But at the same time, the parents kind of had this look on their face of like not seeming like that was what they wanted to do. So I kind of talked more to them about it. And after a lot longer discussion, it got to the point of like the family only had 1 car. This would be really sacrificial for them to try to get child up here. Taking time off of work was just not feasible for them. And after a long conversation, we decided, and they actually asked for resources that they could do at home. And so we were able to provide them resources for them to try at home. And we came up with a plan of returning in 6 months if they did not see improvement. And so that was a really good conversation and a good eye opener for me. I think that was one of the first times that that's ever happened. But I wanted to make sure that the parents had that autonomy and understood that I'm not giving them a prescription here of something that they have to do. This is a choice for them, something that can be done. But I also wanted to give them resources at home if they chose that was the better option. Because it is an option. We can provide resources and do home education, home plans, and parent education. And I think that's a great resource as well. And making sure the parents have the choice for that. So you should be given the time to process and decide what you want to do as a parent.
And I think that's a good example of like parents having the autonomy to make choices. And I think oftentimes people are, I know from personal experience, people are often intimidated by like healthcare workers and because I think what may be happening is people feel insecure about their level of education or knowledge about the particular topic. And so they feel, they're nervous and they're intimidated by, the whole health care process and the, the healthcare professionals who are telling you all this stuff about your kid and what's going on and all that stuff. But it is your choice. Like our job, our mission is to support you. And so please like feel free to let your needs be known. And like in this whole plan, like you said, it's not a prescription that you have to follow. Otherwise you're going to go to jail or something, like you have. And if the plan that the therapist presents isn't feasible for you, then ask about alternatives. Like, is there some other way that you guys can workshop? Like, can we do something maybe a little unconventional?
Mm-hmm.
Like, is there some way that we can try to make this work? Because you want to help your kid
Mm-hmm.
and they want to help you. But sometimes it may take something that's a little bit more like creative.
Yeah.
And that's okay.
Yeah.
That's okay.
It is completely okay. I often give this example of like whenever my car messes up, I have no knowledge of cars, just to give context here. Like it literally terrifies me sometimes to go get my oil changed, honestly, or get my tires rotated, any of that stuff. Because when I go, I know they're going to get on to me and tell me all the things that are wrong with my car, including like, hey, you need to go put gas in your car because it's like on E. And I get that. But that doesn't mean that whenever they make all these recommendations of all the things they could fix in my car, I'm still going to be calling my dad and being like, hey, should we be doing this? Or I'm still going to call, my husband and be like, hey, do we have the finances for this? Or I'm still going to be thinking about like, is this really a good time to be doing this? I have a trip like next week. Like I'm going to be taking all these considerations of like, should we be doing this right now? Or is this best for me? Even though like all these professionals here who know a lot about cars are telling me like, this is what my car needs right this moment.
Yeah.
And so like, I shouldn't feel bad for questioning what they're recommending me. I may even go get a second opinion. And so like, you shouldn't feel bad if this isn't your profession to be like, let me think about it. Or like, is there an alternative here? Or can I get a second opinion? Or no, this just isn't the right fit right now. Like, that's not a bad answer.
Yeah.
No one's going to be mad at you for saying like, this just isn't right at this moment.
For sure.
As much as we want to help.
Yeah.
Because we do have the best intentions.
Yeah. So. That's our whole, we want to help you.
Yes.
That's our whole mission.
Right.
Yeah.
So yeah.
Okay. So after you have gone through the evaluation and if you do decide to continue services, then oftentimes what happens is you'll be scheduled for, oftentimes it's weekly. Sometimes it's bi-weekly, 2 times a week. Right? Hopefully, is that what bi-weekly means?
Yeah. Hopefully individualized to you.
Yes. So hopefully, yes, for sure. I know of, at our clinics, we at most have ever done 3 days a week. And that was on a special occasion, but I know of other clinics where it's very normal, very common for them to do 3 times a week. Sometimes it really just depends. Oftentimes it's like dependent on the clinic, the individual clinics, kind of what their processes are, but it could be anywhere from a 30-minute session. I've heard of clinics up to an hour session per discipline. I've heard of, there are some clinics that do a lot of co-treating where the disciplines work together. And so you may get, multiple disciplines all going on at max 2, at most 2 disciplines going on at the same time to really get a team approach. I know of some clinics that they do 45-minute sessions, others do 50. And so that's going to just depend on the clinic itself. But then intervention looks different for every kid because every kid's needs are different. And so kind of the frequency, meaning like how many times a week, how many weeks a month, for how long is going to look different for everybody. But that will hopefully be a part of that that decision-making process that you have had with your therapist, at the beginning. And ultimately we're shooting for your kiddo's independence and the eventual discharge, meaning the end of therapy services. So is there anything else like more specific that you want to talk about, like about the intervention piece?
I don't really think about, because we've already talked about like what parents should know as far as like what they could ask and things like that.
Yeah, like you said earlier, it will definitely depend on the clinic as to whether or not you're able to go back during the sessions. If that's something that's very important to you, then like please ask.
If you like want a consistent therapist, make sure you ask. Sure. If you feel like, or if you have concerns, like you feel like your child just did not mesh well with a certain therapist, make sure to bring that up.
Absolutely.
People mesh with different people. It's just how we work. Yeah. But I would say, just expect that treatment sessions, they may start off kind of slow. Like you may have to build up Either one, build up to your child's tolerance to be there for a certain amount of time, or to build up tolerance being in a new place. It also might take some time just for the clinician and your child to like build a relationship.
Yeah.
So be patient with that.
Yeah.
But then of course you're valid if you start like having concerns or you feel like there's not progress being made, then make sure that is known as well. But you should see your therapist, working one-on-one and like focusing on your child. You should definitely see that. You may see your therapist documenting some during, which is completely normal, but they should be able to shift focus between that and your child. So that's also important to know. And it may look like play a lot of times, but if you have questions like, hey, are you actually addressing anything? Go ahead and ask your therapist and they should be able to explain it to you.
Yeah, for sure. Yeah, for sure.
Yeah.
Yeah, I think a lot of times people, again, parents are nervous about like asking questions and stuff. And it's like, they'll finish a session and be like, well, all they did was play. It's like,
I would love somebody to ask me like, hey, what all did you do during that play? And I would love to explain it to you.
Yeah, for sure. Absolutely.
Because it does look like play.
It does.
Our jobs are really fun.
They absolutely.
We do play all day.
They are fun. So after you've done some, like a lot of this intervention and the play and all the things and the fun stuff, then our eventual goal hopefully is to discharge.
Right.
Because what that means is we're ending services because your child has gotten to a place where they're independent and they are, or maybe they're not always independent in the moment with whatever skills, but you feel capable of managing it without assistance.
Yeah. And I would like to add, like, discharging doesn't mean necessarily that you never have to come back to therapy.
For sure.
So that's really important too. A lot of times this discharging is just discharging this current plan of care or discharging what's currently going on.
Yeah.
So I like to discharge either whenever the patient is meeting their goals, or like they're meeting like their specific goals in the plan of care, or if the parent feels like they've met their goals, or if we've just kind of met the overall focus for what the parent came in for.
Yeah, we like, just as an example, I had yesterday, maybe it was yesterday, maybe it was Wednesday. Again, that part doesn't matter. But I had a kiddo this week who, like, she had not met all of her goals that were listed in her plan of care. But she was feeling very confident in her abilities. Her parents were feeling very confident in her abilities. I was feeling very confident in her abilities to manage life in a way that was successful. And so did she meet all of her goals, like, specifically? No. But everybody felt very confident in that she had gotten to a place where she didn't need therapy anymore. For now. And with the plan that if things changed or if she continued to have struggles later down the road, then she could always start the process again, in return if that is the case.
Yeah.
So, and then we've also had instances where people have discharged at times because it just becomes too much of a burden on the family. Things have changed in the family. Maybe someone lost a job and they didn't have the income, or maybe someone lost, maybe has been a death in the family. And so there have been instances where the family just didn't have the resources to make their appointments anymore.
There's also instances where maybe like a kid starts going to school when they weren't before. So like the time constraints with that are just not feasible anymore. And those are all understandable reasons.
Absolutely.
To ask to be discharged from services.
Yeah. So there's many different reasons why someone might end therapy. And it's all,
it doesn't mean you can't come back.
It doesn't mean you can't come back.
Which is always a great thing.
Yeah.
Because things change. We've had patients come back before.
And even still, like, I mean, it's very important to have conversations with your clinicians about their progress and how they're doing. But even I've had several parents who are like, we're just going to stop because, they haven't met. My kid's technically still behind, but I'm okay with where they're at and how they're doing. And ultimately, if you feel like you can manage it and you can support your kid and that they can be successful and whatever, then like, sure, it is your decision ultimately as parent to, make that.
Right. And there are other instances where, therapists might recommend a discharge and you as a parent are not ready yet. Maybe you have new concerns or you're worried about certain things that maybe the therapists haven't talked about yet or haven't addressed yet. And so that's also important to bring those up
Yeah,
then
for sure.
you want to bring those up before like the discharge paperwork is done.
Yeah.
So that they can be addressed and maybe reevaluated for those new concerns.
For sure.
Or the concerns can be addressed in new ways, or even the therapist might can give you resources to where you can feel like you have those tools at home to address those, because it might not be something that we can address, but it could be something that we can give you the resources for and still follow through with the discharge. So make sure you bring those up as well.
Yeah. I think that has happened a couple times with, in my experience, where like, we were like, okay, your kid's like good to go. And then the parents like, oh, well, they started doing like there's this other thing. And we're like, oh, okay, well,
it's like shift gears here.
Okay. We will discharge those goals, meaning we're no longer focus our areas on that particular, you know, that particular area. So we're going to shift to this other space.
Yeah.
So
happens.
It does. It sure does. Okay. And that's hopefully a little bit of kind of what to expect a little bit. Hopefully calm some nerves about going to therapy for the first time. And ultimately, what I hope that your initial therapy experience looks like is you meet a lot of really cool people who are there to support you and your kid, and you guys to be as happy and healthy as possible.
And even if you've already started therapy somewhere and you've already went through this whole process, if you have questions or concerns that you've thought of after like listening to this, go ahead and bring those up.
Please.
It is never too late to bring up a concern.
Please.
I think that would be really important.
We serve you. That's our call to action.
Yep.
Is we serve you. So
Cool.
Hopefully this has been helpful to answer some questions and maybe, like you said, provoke some within you to ask your healthcare people, your therapy team. But if you have any other questions about kind of common, we can't talk specifics about you and we are not your personal, therapy providers.
Right.
But if you have other specific, other general, not specific.
General questions.
Other general questions about, the therapy process or what that kind of looks like, then feel free to contact us at our Instagram, the.co-treat.
Absolutely.
And we'll be happy to converse.
Sounds great.
Collaborate.
Woo.
Whatever the word is. Okay. We will see you guys. Oh, wait. Sorry. We have to do our therapy wins of the week. I almost forgot.
Okay. I'm going to go ahead and go with a story.
Go for it.
This isn't even turning into therapy wins. I'm just giving stories at this point.
That's fine.
Okay.
I will continue to do a therapy win of the week.
You do a therapy
You do whatever you want.
I'm giving story time with Magnolia here.
Okay.
Story time with Magnolia is that I actually had an evaluation here recently for my PT. So I definitely had to advocate for myself. I'm not going to go into specifics, but I feel kind of empowered by myself because I advocated for myself, even though I'm typically a very socially awkward person who would not advocate for herself. It was very important for me to advocate for myself during that evaluation because I had concerns that me and the doctor had already talked about and had already made decisions on. And then I felt like we were changing that plan once I got to the evaluation. So I had to bring that up. But they addressed it well and we have a good plan now. But that wouldn't happen if I would have not brought it up. So advocate for yourselves. It feels good afterwards. Promise.
I love that. For sure. On that same kind of vein, my therapy win of the week, I will say, is I've had a couple of conversations this week about, like transitions of services, about like what, therapy is going to look different moving forward. For their kiddo. And so like what that looks like and trying to like answer some questions for the parents and, providing information to the parents and trying to come up with a plan that's going to like suit make them feel comfortable and confident in that plan. And so it's always very rewarding when you leave those kinds of conversations where it's like, it starts with a lot of questions and then it ends with parents feeling confident and secure in like, okay, we've got a plan. We've got an idea of what moving forward is going to look like. And so that's always it's always a good time when you're like, yes, everybody's feeling good about the situation. Absolutely. It always feels like a win when you have these really productive conversations with parents.
Yeah.
So, yeah.
Awesome.
Okay.
We did it.
We'll see you guys next time.
Bye.